If you talk to a dog long enough, they're going to do exactly this, the classic head tilt. Welcome to PetSense. Just a quick reminder before we dive in, while we use veterinary science to explain your dog's behavior, this video is for educational purposes and doesn't replace professional medical advice. When we see that upward turned face, it's easy to project our human body language onto them. We naturally assume they're confused, asking a question, or essentially saying, huh? Recent scientific studies reveal that the tilt is a highly calculated multisensory mechanism. To decode what's actually happening inside your dog's head in this exact moment, we have to look at how their physical anatomy, the hardware, and their cognitive memory, the software, work together. We'll start with the hardware. Dogs possess movable ear flaps, called pinnae, and tilting the head is a deliberate physical adjustment to help them locate high-frequency sounds. When your dog cocks their head, they are changing the alignment of their ears to calculate the microsecond time delay between a sound wave hitting one ear versus the other. This lets them pinpoint exactly where a noise is coming from and how far away it is. Those ear flaps often act as physical barriers that muffle incoming sounds. Tilting the head rotates the flap out of the way, opening a clear pathway straight into the ear canal. Dogs with heavy, drooping ear flaps that completely cover the canal face massive acoustic interference. They rely heavily on this physical adjustment just to bypass the obstruction and hear clearly. The auditory head tilt acts as an ingenious physical workaround, allowing dogs to overcome their own anatomical hearing barriers. Hearing is only half of the hardware equation. According to research by psychologist Dr. Stanley Coren, the tilt is equally driven by visual adaptation. A dog's protruding snout creates a literal blind spot. It blocks the center of their lower visual field, obscuring their view of human mouths and lower facial expressions when we talk to them. By cocking the head at an angle, the dog shifts their muzzle out of their direct line of sight, instantly revealing that hidden lower visual field. The data backs this up. Breeds with elongated, pronounced muzzles tilt their heads far more frequently to see us than flat-faced breeds do. Tilting is a structural necessity that allows them to accurately read facial cues required for cross-species communication. That brings us to the software. A 2021 study from Eötvös-Loránd University on gifted word learner dogs shifted the focus away from physical anatomy and toward cognitive processing. This chart shows the head tilt frequency during the study. When hearing a familiar toy name, the gifted dogs tilted their heads 43% of the time, compared to just 2% for typical dogs. Because dogs process familiar human words primarily in their left hemisphere, tilting the head may route specific auditory signals to the side of the brain best equipped to decode them. The tilt signifies intense concentration, the moment a dog matches an owner's voice to stored visual memory. And then there is the evolutionary biosocial loop. Dogs tilt to process our words. We find it adorable and reward them with praise, and the resulting endorphin release positively reinforces the behavior. A healthy head tilt represents a perfect marriage of sensory optimization and positive human-dog bonding. Now that we know what a deliberate, healthy tilt looks like, we need to talk about what happens when this physical system breaks down. A pathological tilt is persistent and continuous. It happens without any auditory or visual stimuli, and the dog simply cannot straighten their head. A primary culprit for this is vestibular disease, a neurological condition that attacks the balance centers located deep in the inner ear or the brain. This comes with severe red flags that owners must watch for. You might see involuntary darting eye movements, known as nystagmus, along with circling, stumbling, and severe nausea. Painful infections of the external or middle ear canal, or even central neurological lesions, can also trigger this continuous locked tilt. A locked non-communicative head tilt serves as a critical clinical indicator of a deeper neurological or anatomical failure. If these pathological symptoms appear, the first 24 to 48 hours are usually the most severe. This requires an immediate emergency vet evaluation. The good news is that idiopathic vestibular disease often naturally resolves in 2 to 3 weeks. However, a veterinarian must urgently rule out underlying tumors or deep infections first. Under normal circumstances, the canine head tilt is an elegant, multi-purpose tool used for hearing better, for seeing clearly, and thinking deeply. If you found this helpful, be sure to subscribe and leave a comment telling us your dog's breed. Next time on PetSense, we'll be breaking down exactly why your dog digs up your backyard, because understanding the science behind these behaviors bridges the gap between simply adoring our pets and actively protecting their health.